Images of first aid make most people think of broken bones, band-aids, and bruises, but there is a type of first aid that often goes unrecognized. Mental health first aid trainer and responder Jacque Gray is here to talk about a new kind of first response. Thank you for being here today. It's great to have you.
Thank you for having me.
So what exactly is mental health first aid?
Well, as you mentioned, when you think of first aid for bleeding, broken bones, you think of CPR for heart attacks. Mental health first aid is what you would do if you encounter someone that may be suicidal, having a panic attack, in a psychotic episode, or suffering from an overdose.
Where did this concept come from? How did this develop?
It was developed in Australia and has spread through a number of countries around the world, and is now in the United States and has been adapted for here. Mm-hmm. And there's now about 1,200 trainers trained across the United States in 43 states.
Wow, it's a growing trend in a way in this first response. How does the process work? Are there certain steps or an action plan you take?
There is an action plan. In fact, the koala, since it came from Australia, is our mascot, and his name is Algae. And the acronym ALGEE identifies those action steps. Mm-hmm. A is to access or assess whether or not they're suicidal or might harm themselves. L, listen non-judgmentally. G is to give support and advice, information. E, encourage them to get the appropriate professional help that they need. And the other E is to encourage them to utilize some self-help, as with a panic attack, breathing techniques and things like that.
Do you have to follow that order, or is it kind of any type you recognize, or anytime you recognize the signs in somebody? How do you recognize those signs?
Well, that's part of the training, is to talk about what the symptoms are for depression, anxiety, psychotic, substance abuse, several different types of mental health disorders. And then following the system in the order that it is, the ALGEE, it helps a person to remember what the steps are and to kind of go through. And you may not spend a lot of time on one. If it's a panic attack, they're not going to harm themselves. You can move pretty much into the listening and more of the active parts of the method. But you follow the same routine each time, and so it's easier to remember.
Okay. You are a trainer and a responder. During the training, is there any interactive things you went through to get a feeling of what these crisis situations are like?
The training is very interactive. We have small groups, we have lots of activities that we do in order to get across the concepts. So it's not like you're sitting in a chair for the whole 12 hours of the training. We have people moving around and doing a lot of things during the course of the training, and so it's a lot of fun too. Like with the algae, there's a rap at the end of it that reinforces what the acronym is for, and we have a lot of fun with that too.
Is there any kind of things you go to deal with certain type of situations? Is there something you go through to learn about psychotic disorders or psychotic episodes that somebody might have?
Well, again, we go over the symptoms of each of those, but we don't expect the person, this isn't to make someone a therapist or a counselor. It's strictly to provide that immediate action that's necessary to stabilize the situation, de-escalate, and get them to the resources they need.
Are there certain groups that you would target for this type of first response?
Really, first responders, police, fire, EMS, hospital staff, schools and their personnel, youth facilities. There are anywhere that you might use first aid or CPR training, you should have mental health first aid training as well.
Now that you have this training, how do you feel now going into a situation or a crisis situation you might come across?
Well, I'm a trained counselor, but it reinforced a lot of the things I'd already been through in training, but it helps to give the non-professional person some things that they can do to where they feel more confident and competent. They're more apt to step forward and intervene in a situation than they might have been before.
How do people at home get involved in mental health first aid training?
They need to contact a trainer. if they want to go to www.mentalhealthfirstaid.org, there's a list there of trainers in all the states where they have the trainers, and you can contact a trainer there in this area. I'm a trainer, and if people contact me, then we could try to set something up.
Well, thank you so much. I know it's new and unrecognized, but it's so helpful to know what it is and get the word out there. Thank you so much.
Thank you.
Yeah.